It's beginning to feel a lot like Christmas. I've talking to my friend over there. I've got my Christmas lights up, and I'm hoping this year that Santa's going to bring me a 23andMe genetic test, because I'm really excited to learn about what that technology holds in it. My role, as Liz alluded to, is to help Lancashire build a strategy or a plan around how digital health can help people. When things get really difficult, one of the things that keeps me going is my firm belief that we are on the cusp of a consumer revolution. Things are radically going to change in the future, and I really believe that digital technology can help people to be healthy and well. Some of you will have heard me talk about this story before, but I've got two stories today that I'm going to tell you about that reaffirms some of my thinking. The first one is about Hayley Fraser. I don't know if anybody saw this on the BBC News fairly recently. Hayley, particularly brave young girl, was born without the fingers on her hand, and she'd been in the health service since birth. And one of the conclusions that the health service had come to was they were going to graft her toes onto her hand, but her family didn't like that idea. Her father in particular was very upset about that idea. And what they did is they took the power of technology, they used the internet, and they got in touch with a guy in Brazil, I think it was, who sent them a digital file, a 3D printer file. And they got, for 50 quid, they got her hand printed out in pink, which was her favourite colour. And this little girl's life has been transformed with this piece of technology for £50. And I think if there's anything that sort of epitomises what technology can do, and the power of people, I think that's perhaps just as important. So that story was really, really quite powerful for me. More recently, my wife got a new pair of glasses last week, which I hear you say, well, that's not particularly radical or particularly innovative. It is when you think that she's lived through her whole life with a very unusual eye condition. I won't try and name what it's called, but it shares a name with the singer from Atomic Kitten who shops at Iceland. So this condition meant that she's always going to have contact lenses, and she has to get them from America. And she went to the eye clinic literally a month ago, and they said to her, you need to have a new set of contact lenses, and why don't you try some glasses? And she went, what do you mean? Well, you can try some glasses if you want, I can give you a prescription. And she said, I've always been told I could never wear glasses. And this has meant to her over her life that she's not been able to drive when her eyes are sore and she can't go out the house. It's been really debilitating for her. Anyway, this young doctor tells her, no problem at all, you can get some glasses. And at last she's got some glasses. Now what that tells me is how the organisation that she'd been in care of was looking at a specific condition and not her life as a whole, and the condition and how she lives. And just this small change made a big difference to her. Now, interestingly, there's not a lot of information, like the guy who Googled somebody in Brazil. Which brings me to this placard. What's this all about? Well, in Lancashire, one of the things we're really, really keen to do is to create a social movement. What we really want to do is concentrate on people and not patients. And the part of the story for me is around technology, how we can make technology work for people, to empower them, to enable them to live independently and healthy and well. It's been, for me and for others, a really busy year. We started off with a strategy, I'll put this down. And what we've been doing is we've been meeting with lots and lots of people. Many of the people in this room we've met with over the last year, my colleagues and I. We've made some great relationships. We've engaged the leadership and the workforce in Lancashire, and we've still got some work to do. And that's what this is all about. It's about empowering people. We've tested a lot of the technology, and we've got some things up and running. And we're really moving forward now in terms of how we can integrate. And I'm a great believer in how we can standardise technology. And what I want to try and do in Lancashire is get the information that resides within all those organisational silos across health and social care and make it available to people who need it, who are caregivers, and care receivers so they can make the best possible choices. We've commissioned a fantastic IG tool with the support of the Academic Health Science Network. I hear you say, well, that sounds very boring. Actually, it's incredibly important. And one of my colleagues, I don't know if she's in the room, I haven't seen her. Yeah, she's waving at the back there. Her colleagues, Helen and her colleagues, have developed this tool. And it's a really important step in moving things forward to empower patients and empower people. And I'll come back to that in a minute. And we've started a lot of design work. The next year for me is going to be all about how we can work with people like Alison to use technology to empower people. There are 3 themes that we're working on in Lancashire. The sharing of information, which has all been this last year. Empowering people by giving them information and being able to use that information and contribute to their own health records, health and well-being records, that is. And to enable people through the use of technology. The year ahead is going to be, I think, even more exciting. What you see on this diagram is that IG tool, which in itself is very, very simple, but very effective in what it's doing. Hopefully we'll have this up and running by February, and it allows us, organisations, to unlock the potential of that information that sits in there. And for the industry suppliers in the room, what a lot of them really need is that information. I think our guy from Red Ninja was saying, getting that information is really, really difficult. How can we make that very much easier for people to do? So what do I see this next year going to be for us? It's going to be about more collaboration, working with our industry partners, working with academia. We've started a number of conversations with our local universities. And for me, it's like manna from heaven, being able to talk to those people, being able to listen to what they're talking about, to harness some of the creativity and ingenuity that's going on in our universities. It's to mobilise people. We really want to create a social movement, and hopefully some of the people in this room are going to be joining us in this movement to use technology. We're going to continue to evolve and develop our plans. We're going to move forward on something called LPRES. It used to be called the Lancashire Patient Record Exchange, but that doesn't fit anymore. It's about people, so it's going to be the Lancashire People's Record Exchange, and it's going to move data across the system and ultimately, in the very near future, to the citizens of Lancashire. They'll be able to access their information, they'll be able to add to their information. And then hopefully, and this is again where we bring in people like Alison, get clinicians, caregivers to use that information that's been put forward and to help people make the right choices. We're going to be starting work on developing our health and wellbeing platform in this next year. We're going to be needing to look at how we can use storage technology, identity management and all sorts of things. And the reason we're doing this is because we want to create a mechanism where people can use apps and web technology wherever they want and be able to draw their information into the tools that they really want to use and not be locked down by an organisation or a pathway. It's about opening it up and empowering people. Thank you very much for listening and have a good Christmas.